Hi everyone, Dr. Knackstedt. If you have a diagnosis of breast cancer, I'm sure that you've seen all of the patient groups and forums on the various social media platforms. So let's talk about what these platforms are great for and what they should not be used for. So the first thing that I think that these forums can be really great for is building social networks. We've talked before about how social networks have literally been associated with mortality outcomes in breast cancer. You want that circle of people that you can rely on and talk to. And social media can be a really great way to find people who have been through similar situations or are currently going through them. Love social media for that. I also really like social media as a place for patients to get kind of a vague idea about what reconstructive options are. I've had patients come into my clinic asking for a Goldilocks procedure, not even knowing that anyone in my institution offered it because they saw that on social media and they thought that that might be a good option for them. So if you get this kind of vague overview of reconstructive options, you can then bring that to your plastic surgeon and have a foundation for an educated discussion about what options may or may not be good for you and your circumstances. So those are things that social media can be really great for. What social media is not really great for is asking for medical advice. So I have joined many of these groups to see what patients talk about. It's been very educational for me. And sometimes if I see gross medical advice being offered by individuals on this forum, I will weigh in, but I try not to. I see patients asking questions about when should they remove postoperative dressings, uncontrolled pain and not knowing what to do, drainage from breast, red breasts, things that are kind of medical emergencies, like should be going to the emergency room situations, and they're coming onto social media. Now, they might be doing this because they can't get through to their surgeon, and if that's the case, then you do need to just seek medical care at an urgent care in an emergency room. Social media is not the place to ask about when to remove postoperative dressings or how to manage your medications. So please, if you're using social media for that outlet, just be careful. The people on these forums giving advice, yes, they have a history of going through what you're going through, but they're still not healthcare providers. Reach out to your healthcare team. But I love using social media to get those social networks. And I really love people getting really honest opinions from other patients about their experience and their outcomes and looking at really honest before and after photos. If you've joined one of these groups and you found something to be helpful or not helpful, let me know below. I'd love to continue the discussion.